welcome to our panel discussion on the topic, digital transformation and the evolving role of pharmacists in patient care. I'm Lucy Falcioni, Vice President of Payer and Provider Solutions Operations at TELUS Health, and I'll be your moderator for today's session. The last few years have presented a major shift for many pharmacies in Canada. Provinces and territories across the country have or are in the process of rolling out numerous changes that increase pharmacists' responsibilities, including adding to the growing list of minor ailments pharmacists can prescribe. While these changes present a huge opportunity for elevating the role of pharmacists in Canada's healthcare future, it also presents real challenges. We have an incredible panel with us today who will share their invaluable knowledge and insight on how these changes are shaping the pharmacy industry, impacting pharmacists' day-to-day operations, as well as the role that technology and innovation can play in adapting to this changing landscape. I'm delighted to introduce Greg Harpel. Greg joined TELUS Health in June 2022 as General Manager of Pharmacy Solutions, a business that serves over half the community of pharmacies in Canada and plays a pivotal role supporting other pharmacy verticals, including specialty, long-term and residential care, high-volume and central fill facilities. With over 20 years' experience across health system strategy, technology, retail pharmacy, and management consulting, Greg continues to drive customer-centric teams to deliver innovative and enabling technology to support Canadian pharmacy teams in their expanding mandate for pharmacy and primary care services. John Lee. John is the Director of Pharmacy Innovation and Central Fill at Sobeys, where he leads the development and implementation of pharmacy innovation and central fill strategies. Since joining Sobeys in 2011, he has held various leadership roles, including Director of Pharmacy Operations and Pharmacy District Manager. John brings nearly 20 years of experience across retail, long-term care, and home care pharmacy. He currently serves on the Board of Directors for the Health Products Stewardship Association and is a mentor for students at the Leslie Dan Faculty of Pharmacy at the University of Toronto. Jason Chenard. Jason is a practicing pharmacist and owner at Shaw's Pharmacy in Sudbury, Ontario, and the owner of Noelville and Alban Pharmacies in French River, Ontario. He graduated from the Leslie Dan Faculty of Pharmacy at the University of Toronto in 2008. He is a board-certified geriatric pharmacist, certified diabetes educator, and the founder of Layered Leadership, a leadership and wellness platform for pharmacists and their teams. A warm welcome again to our wonderful panelists. To start, let's talk about how pharmacy practices have evolved. Pharmacists are taking on more clinical responsibilities than ever before, administering vaccines, prescribing for minor ailments, and playing a bigger role in chronic disease management. At the same time, they need to balance these expectations with operational realities. John, Jason, and Greg, I'd love to hear from each of you. How do you see this evolution impacting pharmacy practices? With that, John, we'll start with you.
Great question, Lucy. The reality of it is we are already seeing this evolution happening, and the future of pharmacy is really exciting because pharmacists can now have the opportunity to put in practice many more clinical skills that they learned in pharmacy school to help improve their patients' health outcomes. In most provinces, pharmacists can assess and prescribe prescription medications, mainly for minor ailments. They can renew refills without having to go to the doctor, prescribe and inject many vaccines, and order and interpret lab results. However, the increased workload means that pharmacists requires the tools to provide these expanded services proficiently and with quality. Now, how is this impacting pharmacy practice? Well, especially since the pandemic, where pharmacy was the central hub for the delivery of COVID-19 vaccinations to communities across Canada and the healthcare provider that was most accessible when businesses were shut down. More and more patients are recognizing pharmacy as being a destination for primary care. The demand for pharmacy services is also pronounced because of a rising number of unattached patients. These are patients without a primary care provider, such as a family doctor, coupled with a growing senior population where people are living much longer into old age. Unfortunately, there is a trend towards a shrinking cohort of healthcare professionals to care for our seniors and communities. Governments are increasingly looking to pharmacies due to their abundance and accessibility to take on that primary care role.
Thanks, John. That point about accessibility really resonates. The pandemic didn't just accelerate the public's reliance on pharmacy, it crystallized it. And Jason, you've been on the front lines as both a pharmacist and a pharmacy owner. How has this evolution, from your perspective, changed your practice?
Thanks, Lucy. Overall, we see improved access to the pharmacist. We know that the pharmacist was and still is becoming the first point of contact and is more accessible than ever. But this new scope is further empowering the concept of the pharmacist being the most accessible healthcare provider on the team. Paying the pharmacist will save the healthcare system tons of money, and it better utilizes other healthcare providers as we approach it from a team perspective. From the patient point of view, it also reduces wait times and improves the overall patient navigation of the healthcare system. Back to you.
I love how you framed it, Jason. It's not just about expanding the pharmacist's scope. It's about rerouting the patient's journey to be faster and more efficient. And it benefits the whole system. Greg, from that high-level lens, how do you interpret this evolution?
Thanks, Lucy. I would certainly agree with what Jason and John have articulated about the opportunities that pharmacy has to play as an increasing access point for primary care. Our healthcare systems are in perpetual state of crisis. We hear all the time about physician shortages and the number of people without a primary care doctor. Moreover, when we ask ourselves, what does Canada have going for it? We can look at pharmacists as a relatively accessible and critical point and resource. If you look at the international benchmarks for the OECD, for example, over the last decade, Canada generally ranks somewhere in the top 10 in terms of pharmacists per 1,000 people. That number changes dramatically when you look at physicians, with our ranking dropping to beyond 20th place. So really, why wouldn't we look to maximize the use of pharmacists in their clinical areas of knowledge?
Thank you, Greg. It really puts the opportunity into perspective. And the international benchmarks underline the urgency. So if the pharmacists are becoming the new first point of contact and absorbing more clinical responsibility, it begs the next question. As these responsibilities grow, Jason, how is that changing your day-to-day pharmacy operations? And what new skills or competencies do pharmacies need now that weren't as critical 10 years ago?
Certainly things have changed. It's less about the product now and more about the patient themselves. Pharmacists are having to defer the technical duties while other staff are emphasizing the clinical skills. We're moving from being verifiers to being inventors. I think of it a little like the pharmacist mindset being a teleprompter, where in the past we would check the physician's work as the prescriptions were coming into us. And now we're creating all of that from the get-go as we prescribe. So pharmacists have to be more clinically savvy because the patients, physicians, and the overall healthcare system now have higher expectations on the pharmacist. There's more medical info available and coming at us with clinical viewers where we share the medical documents within the healthcare team. And we have to get better at uncovering the clinical interventions and also make sure that we're connecting those to how we can get paid for our work. So it's less about the product, more about the patient. 10 years ago, we would fax a doctor a prescription, or we would fax the doctor permission to make a change to a prescription. And today, we simply initiate that change ourselves without that permission. We extend a refill, we adapt the prescription, we prescribe ourselves, and we might even inject it right there in-house.
It paints a vivid picture of how multifaceted modern pharmacy has become, from clinical decisions to patient engagement. John, Building on what Jason shared about the shift towards clinical care, how are you envisioning a refined pharmacy workflow that supports this evolution? And what does it take behind the scenes to make that transformation happen? And in your view, what capabilities are non-negotiable for pharmacists to thrive in this new, more patient-centric model?
Yeah, thank you, Lucy. The day-to-day operations in pharmacy have changed. And one example is pharmacies are increasingly leveraging automation to allow pharmacists to focus more on clinical services and patient counseling, rather than being bogged down by repetitive technical tasks. And when we allow the time for pharmacists to practice at their top of their scope, they're able to do the things I mentioned pharmacists can do, like assessing and prescribing. And this shift not only improves workflow efficiency and accuracy, but also fosters a more patient-centric approach. And I really want to emphasize accuracy here because prescription filling quality is everything in our business. Automation can't just be fast, but it needs to be as close to error-free. Now, compared to a decade ago, there is just so much more that pharmacists need to know from a clinical perspective. And to stay on top of that requires continuing education, self-directed learning about new therapies, understanding the latest guidelines, and even upskilling themselves to perform additional scope. Above and beyond this, pharmacists also need to be familiar with and competent with using EMRs and EHRs that allow pharmacists, for example, to record publicly funded vaccinations or to help them make better decisions that lead to improved health outcomes. Another thing we're seeing in pharmacy practice is modernizing how pharmacists assess and document clinical services, transitioning from a pen and paper model to a streamlined digital tool that, for example, will help pharmacists navigate minor ailments, assessments, and prescribing. Pharmacies are also tasked with learning about the digital patient engagement tools that they might offer to help patients wanting to self-manage their prescription refills, new orders, transfer prescriptions, or even request a delivery with an app on their smartphone. Now, these digital tools are great, but challenges that pharmacy operators often experience is lack of integration with their pharmacy management software, swivel chairing between different applications, and even having to remember multiple passwords. And that's why it's so important to work closely with vendor partners and mutually share feedback and collaborate to overcome those challenges.
Thank you, John. Greg, picking up on what Jason and John have shared around the increasing clinical load on pharmacists and the growing need for operational efficiency, how is technology stepping in to support this shift? Do you see any changes in the way the pharmacists want to interact and leverage their technology to help streamline their operations and put more focus on patient care? In the pharmacy industry, what common features or solutions are they asking for to support their practice?
The increasing responsibilities that John and Jason articulate translate to more demand on their team's time. So from a technology perspective, we really need to ask ourselves, how can we give some of that time back to the pharmacy teams? We can do this in several ways. Providing tools that allow some pharmacy activities to operate at scale. Central fill is an area that we continue to see demand in and make investments for in our technology in order to enable that and give that time back to pharmacy teams. Through ongoing expansion of digital tools such as PharmaConnect that allows patients to proactively manage their medications, reduces phone calls to pharmacies, and allows refill requests to arrive with plenty of time for pharmacy teams to prepare those prescriptions more efficiently and focus more on clinical services. One of the largest enablers for central fill, for example, is the penetration of pharmacy patients using digital tools such as PharmaConnect. Streamlining and automating aspects of the pharmacy practice today, such as inventory management, clinical and administrative documentation, and interprofessional communication and interoperability of technology will certainly make a difference.
Thank you all for those rich insights. It's clear that pharmacy practice is in the midst of a powerful transformation, from task-based roles to clinical leadership supported by automation, digital integration, and an important focus on patient care. With these changes come new challenges, as we all know. We've heard a lot about workforce shortages, despite of the stats we heard earlier in comparison to primary care doctors. Coupled with that, we are seeing increasing complexity of regulatory requirements. Let's break this down further. To ground us into the big picture, can you share your perspective on why there is a pharmacist labor shortage? Any insights on the productivity gap in the pharmacy industry? And what are the challenges and opportunities related to the current pharmacy regulatory environment? And with that, John, I'll pass it to you.
So one of the main reasons for the pharmacist shortage is because there's simply not enough pharmacy graduates. Canada's population is growing, so the demand for pharmacy services is increasing. Between 2011 and 2021, Canada's population grew by more than 11%. So you might ask, so why not graduate more pharmacists? Well, the answer is it's a complicated issue. Pharmacy is a 4-year doctorate program and can only be applied to after at least minimum 1 year of undergraduate studies with prerequisite courses. Tuition ranges from $20,000 to $30,000 per year, and many students I've heard can't afford the tuition fees and are pursuing other career paths or are delaying their application. There are also other reasons for the staffing pressure. The process to have international pharmacy graduates licensed in some provinces is sometimes cumbersome. And many pharmacists are choosing to leave the profession or work part-time due to burnout. Sobeys is helping to address the pharmacist shortages in a few ways with tuition assistant programs, flexible work arrangements, and investing in technology such as automation to improve productivity. Now, on the topic of productivity, from a general productivity standpoint, there has been a significant slowdown in Canada's productivity since the pandemic, when it has stayed relatively stable the 3 decades prior, and this is quite alarming. Productivity is important because it's a crucial indicator for economic growth. Well, what can we do to improve productivity in the pharmacy industry? I believe it is further investment in innovation, technology, automation, and addressing the pharmacist labor shortage to continue to deliver healthcare services more efficiently. Now, switching gears, I'll answer your last question. The pharmacy regulatory environment is indeed complex and still evolving, presenting both challenges and opportunities in various areas. For example, one is remote pharmacists. So the rise of real-time communication software allows pharmacists to provide services remotely or perform clinical or technical checks remotely. But it also necessitates a robust regulatory framework to ensure quality and safety. Now, navigating these challenges and opportunities requires collaboration among regulatory bodies, professional organizations, and the pharmacy community to ensure that regulations keep pace with advancements in the field.
Thank you, John. It's an incredibly comprehensive overview that you provided. You've really highlighted how the labor challenge is interconnected with education, economics, and system design. And that productivity gap, especially post-pandemic, is such an important lens to keep in mind. Jason, let's bring this down now to the store level. What's most pressing in your own pharmacies? And what are the biggest opportunities when it comes to innovation that could help you address these challenges?
I think John spoke about the pharmacist shortage very well. To add or to complete the puzzle, I should talk about the rest of the pharmacy team. So it's not just the pharmacists, it's about the overall team and all the different responsibilities in the pharmacy, from the front shop to the dispensary, whether it be pharmacy assistants, technicians, delivery people, and all the other things that have to happen to make everything work very well. There's a lot of pressure, specifically in Ontario, from my perspective, about increasing minimum wage in a quick way. That puts pressure on the entire staff grid, of course. Also, the younger people that make up a big part of our workforce cannot exactly work from home, not in a traditional pharmacy. A pharmacy assistant type job or all of the related jobs don't exactly also come with social media job titles. So you're not the CEO of anything, you're not the founder of anything. It's a little less attractive than what all your friends are showing on social media. Also, it's a grind, the pharmacy profession. It's not something that you typically can make a lot of money very quickly for. And if you're a post-secondary student and you only have 12 weeks between semesters to try to pay for tuition for the next year, then pharmacy might be a hard spot to find if minimum wage only goes so far and we need to balance the entire wage grid in the pharmacy. I would say furthermore, if you're a full-time pharmacy assistant, it's hard to make a living. And the employer has been having to adjust their wage grid, but they can only go so fast. The pharmacy itself is also navigating a lot of red tape in the profession. Perhaps it's new compounding regulations, it's having to put in time-delayed safes, intense documentation for the new clinical services, and all of the new work that we're trying to uncover and discover ourselves. So we're balancing the higher wage rates with having more hands. So where I might have needed to hire in more recent time, I wouldn't have been able to because I have to make sure that I'm competitive with the current hands that I have. Making sure that people are paid fairly and that they're well compensated so that they can be here in a sustainable way for the pharmacy and their community. The pharmacy itself has been highly scrutinized through various audits from private and public drug payers. We've had new regulations capitating our billing on markup and dispensing fees. And there's a lot of politics when it comes down to generic costs of drugs that affect the pharmacist and all of their margins. We are working very hard to automate workflow and automate all of the things that we do so that we can make sure that we're capitalizing on what's there, while at the same time reducing all the human error that might be involved with scaling up and making sure that we're not making billing errors to lose out on the margin that's already there. We're also using or working towards using e-forms that prompt for all of the proper documentation involved in prescribing and injecting and all of the new scope that we have. Back to you, Lucy.
Thanks, Jason. It's a great example of how practical innovation, especially on the documentation as an example in billing, on the billing side of things, can have a big impact just on the day-to-day sustainability. Greg, you've had the chance to hear the realities of on the ground from both Jason and John. From your perspective, how should we be thinking about these challenges across the pharmacy ecosystem?
Thanks, Lucy. Without oversimplifying things, more often than not, it comes down to people, process, and technology. And in the case of pharmacy, how does the regulatory environment enable or restrict ensuring that pharmacy has an adequate supply of people who are trained through support of university or other post-secondary programs that are also under strain, as John mentioned, and as Jason alluded to, that these professionals are adequately supported through sustainable business and compensation models for the services they provide, and unencumbering these professionals through efficient and effective clinical and administrative workflows, payment and compliance processes. Finally, maximizing the role that technology plays in creating efficiency and improving outcomes with the regulatory framework and cadence that supports it.
Thank you, Greg. It's a great reminder. Progress really comes down to people, process, and technology working together. And on that note, let's shift to how technology is helping pharmacists deliver better patient care. Greg touched on the role of technology in pharmacy earlier. With increasing demands on pharmacists, digital tools and automation have become essential. But implementing these solutions isn't always as straightforward as one would think. Technology is playing an increasing role in streamlining pharmacy operations and enhancing patient care. Jason and John, what innovations do you see making the biggest impact? And how can pharmacists balance high-tech solutions with patient-centered care. Let's start with you, Jason.
Thanks, Lucy. When I think of change, I think of two different pieces. The first type is the change that affects the staff. So it's very internal. That's what the customer, the patient doesn't see. The e-prescribing, the robotics, and all the automation are good examples. Barcoding at your POS level so that you can scan things, using perpetual inventory that automatically will reorder what you sell, whether it be the front shop or in the dispensary, are all the type 1 staff changes that nobody really sees. The second piece, and in some ways for the entrepreneur can be a little more risky, is the type of change that affects the patient, the customer. The patients now will book their vaccines using software, and they may not even know that pharmacist. They might use a mobile app to refill their prescriptions, or they might put in their prescription number over the phone to have it ready when they come into the pharmacy. In my pharmacies, we have customers who pay us by e-transfer if we can't see them, or we might pay vendors by EFT directly. We also will send out our delivery driver with a tablet where the patients, regardless of their age, are going to be capable of signing on their tablet. So the internal change, or what I've learned from the change that affects the staff, is that it's important for the pharmacist to explain why, and important for us to have those conversations about what the true benefits are, making the staff part of the planning process and making sure that they're ready for change is critical to the success of that adaptation. And also, specifically for an independent pharmacy, I've known that we have different needs than a larger, perhaps more corporate pharmacy, or a pharmacy that's in a different region of the province. So we have to make sure that we're making changes that we're ready for and needed, and not just because something is fancy or trending. For the patient, we have to make sure that the staff is capable of coaching. We need to make sure that the relationship has been established with the patient. And if we're going to ask them to make a change like book your vaccine or book to come and see me, that's a different scenario than what we were in previous years. So we have to make sure that the staff has the one-liners that they need, and we have to make sure that we've done a good job at coaching the staff to explain why a change is needed, so that the customers buy in, understand, and understand that we're doing this for them so that we can be more available and accessible to them when they need us most. I'll pass it on to John, I think, part two.
Great points, Jason. I have some similar thoughts. In my personal opinion, I believe the innovations that are making the biggest impact are central fill. So due to short staffing and growth beyond capacity, pharmacies are increasingly using automation to enhance efficiency and accuracy in prescription filling and serving a wide network of pharmacies, such as across the province. And the current pharmacy model's two major workflow functions will split into drug distribution and clinical services. Another one is digital healthcare. Digital healthcare is transforming patient care through telehealth and mobile. So for example, Sobeys has an app called 360 Health, and it's based on the TELUS PharmaConnect platform. And patients can use it to view their full prescription profile, refill prescriptions, order new prescriptions, and even schedule appointments for consultations and vaccinations. And it sends reminders via text. Technology is also enhancing medication therapy management by improving drug adherence through personalized care plans and remote monitoring. Finally, I believe that electronic health records are becoming more integrated and more interoperable. And what this does is improve data sharing between healthcare professionals to improve patient care coordination.
Thank you, Jason and John. What you shared really highlights the breadth of innovation happening on the ground. From patient engagement to central fill, it's clear that technology is touching every part of the pharmacy experience, behind the counter and beyond it. Behind every successful solution is a technology partner, working to ensure it integrates smoothly into the pharmacy workflow and delivers real value. Greg, knowing your wonderful experience and expertise, and from a vendor perspective, how is TELUS Health approaching the challenge of enabling innovation without disrupting already busy pharmacy teams?
Thanks, Lucy. I mean, this is an inherent challenge faced by technology companies serving busy healthcare professionals and pharmacy teams. With the accelerating pace of technology and innovation, how do we introduce new technology and innovation and surface it in a manner that doesn't disrupt well-established workflow and practice efficiency? There are a few areas in particular where technology and innovation can support pharmacists in providing more seamless and integrated patient care. One aspect informing our approach is that technology solutions and recognizing that the patient journey no longer starts when the patient enters the four walls of the pharmacy. Customers are increasingly seeking to add capabilities that allow them to support more omni-channel offerings and approaches that both Jason and John have mentioned here today. For example, text reminders and the ability to book various clinical pharmacy services through online scheduling, or proactive and predictive AI and data models that support product and clinical intervention recommendations based on how well the pharmacy teams know their patients.
Thank you. What's really coming to light here is that success in pharmacy tech isn't just about innovation. It's about intention. Whether it's reducing complexity, unlocking capacity, or supporting new care models, the technology needs to fit the pharmacy environment. Greg, we've heard from Jason and John about the tools that are making a difference in both workflow and patient care. At TELUS Health, we've been supporting our pharmacy community through our pharmacy management solutions for decades. Could you share some examples how we have supported our clients in the adoption of new digital tools that help them streamline their workflows?
A great example is one of partnership, and one that marks our more open approach to how TELUS will look to continue to offer leading-edge technology to pharmacy teams. Through regulatory shifts that increased access to minor ailments prescribing in pharmacies, TELUS partnered with another leading Canadian vendor, Vigilance Santé, to seamlessly surface their RX Consult Action platform and minor ailments prescribing solution that supports pharmacists in walking through the clinical requirements, documentation requirements, and billing to provide greater access to clinical care. TELUS has invested heavily in opening Kroll up through a set of modern APIs and will look to partner with an increasing array of best-in-class technology providers to better serve the rapidly evolving needs of an increasingly complex pharmacy sector. So look for more partnership announcements to come.
Thank you. We've talked about what's working. But now let's shift to what makes adoption successful. Jason and John, what would you say are the most critical success factors when it comes to implementing digital tools in your pharmacies? Jason, we'll start with you.
I think the only constant in the profession is change. And what I've learned in being a practicing pharmacist from different size pharmacies over the last 15 years is that we need to do it together. You know, no matter how good of a pharmacist we are or manager we are, we're not going to make it happen by ourselves. And we need to bring our staff along for the ride. So the way I describe it is we need to show our map. The team needs to be involved and give their insights. We need to be collaborative, and we need to be transparent about why we need to make a change. And in all of that, while change can be scary, we need to do a good job of making sure that we've said that we're not replacing people. Because as we move closer to robotics and automation and computers, we need to make sure that the reason that we do that is so that we can free up the people that we have to have the interactions with other people. And at the end of the day, our job is about people, more than it is about robots or pills. While robots add a layer of safety and unlock what humans do best, it's humans that build relationships. And at the end of the day, regardless of what it says on the pharmacy door, that's why people are here. because they want to see their pharmacist, they want to see Jason, they want to see Lucy, they want to see John, they want to see Greg. And it doesn't matter at the end of the day who is visiting, they're looking for those people. So yes, we use robotics and technology, but at the same time, it's all about people, and we have to be very transparent and do it together. Pass it on to John.
Yeah, thanks, Jason. I believe it's working with great and innovative vendor partners. I strongly believe that the 4 success factors for the adoption of new technology are strategic partnerships, effectiveness, knowledge, and ease of integration. And automation production downtimes is extremely impactful to pharmacy. So if a pharmacy needs to wait for replacement parts or a technician to fly across the country to fix the issue, or the machine or digital tool breaks down due to maintenance, it has a spider web of effects, from distrusting the technology and even patients missing a dose of medications. Integration is also important because it reduces swivel chairing and using more than one system, such as middleware, and having too many different systems linking together can lead to errors. Also, we see in the news that there is a rising number of cyber attacks. So how do our vendor partners get automation software up to standard and compliant to mitigate or even prevent its effects?
It's clear that while the right technology can dramatically improve pharmacy operations and the patient experience, the real difference comes from how it's introduced and integrated. When it's done well, it doesn't just reduce friction. It frees up capacity for what matters the most. Let's now shift gears and look ahead. John, as a mentor at the University of Toronto's Faculty of Pharmacy, you've had a front row seat to how the next generation of pharmacists is being shaped. From your perspective, what changes do you expect in the education and training of new pharmacists as they transition into the workforce?
Yeah, thank you, Lucy. So from speaking with students, educators, and program administrators, it is clear the next generation of pharmacists want to practice in an environment that does not resemble what we see in its current retail or community setting. And what I mean by that is that new pharmacists are eager to practice top of their education and fully utilize their array of clinical skills in family health teams, pharmacist-led clinics, consulting for pharmaceutical manufacturers, and virtual and telehealth to have a better work-life balance. I also believe the next generation of pharmacists are also very entrepreneurial and strive to be the next leaders to drive innovation in automation and digital technology. Having said that, though, I would expect that pharmacists will look to gain adjacent skills and education in engineering, software programming and coding, as well as business administration. Also, I do strongly believe that it is important for these pharmacists to invest time to experience and truly understand all the pain points of pharmacy workflow and solve those problems with innovative solutions. Perhaps this may mean experiential training in different practice settings, like a pharmacy central fill facility, which is something Sobeys offers through its early careers programs, which provides internship opportunities for pharmacy students, along with other student positions that offer progressive learning experiences in community pharmacy operations.
Such an exciting picture, John. A generation that's not only eager to lead, but ready to innovate. And your point about giving them real-world experience earlier on is so important, John, especially as the profession continues to evolve. Jason, turning to you. As a pharmacist and a successful entrepreneur, what qualities should the next generation of pharmacy leaders cultivate?
Thanks, Lucy. I hope you use the word successful loosely. But what I've come to realize about myself is that over the last 15 years, I have a habit of journaling through problems and solving things in the pharmacy. And if I look back to years of journal entries, what I was trying to do was figure out what characteristics bring out the best leader in pharmacy. And when I flip back and try to dissect all the different notes, I realized there's 7 recurrent themes that have come up in me trying to solve the problems that I've been around. And those 7 things are the characteristics that I believe I need to emulate to be an ideal pharmacy leader today. And what I've done is I've taken those characteristics, I've paired them with an adjective to make them very specific, so I knew what I was shooting for. And I've described this all online in more detail at layeredleadership.ca. But I've described this by the layered anagram. So the 7 characteristics, the L stands for limitless humility. And this is where a pharmacist needs to put their ego aside, and while they are the ones that went to school and had professors driving them and pushing them, saying that you are the primary healthcare provider, you're the one leading the way, I realize that we have to step back and make it about our team and not about ourselves. The A in layered stands for absolute autonomy. And that's where we have to allow others to be in charge of certain aspects of the pharmacy. We certainly can't do it all ourselves. And the best changes and the best tweaks of improvements happen when we do it as a group together. So we need to allow pharmacy assistants, technicians, front shop clerks, delivery people, and all the support staff that make up a pharmacy team. We need to give them things to be in charge of. It gives them purpose, and it allows them to come back to work every day and do a great job. The Y of layered means that the pharmacist yearns for culture. Whether we like it or not, we're building a culture in the way that we do things and the way that we go about doing it our way. But we need to be cognizant of how we do it, what we say, how we act, because how that happens will be the way that we cultivate our way that others will emulate around us. So we need to monitor our culture, and we need to yearn to create the one that we desire for our pharmacy. The first E of layered stands for elemental belief, because not every day is going to be easy, and not every day is going to be a win, but we need to make sure that we believe in ourselves, and we believe in the capability of our teams. The R stands for relentless systems and structure. And what I've come to appreciate a lot, and where I have been somewhat successful in the small areas of the pharmacy, is working at creating a flywheel that can operate a system very well without me trying to spin it every day. So if it can operate well in perfection and do it without me, then that's when I don't have to micromanage anything, and I can support the patient, the staff, and whatever else might need me that day. The second E stands for esoteric grit. Esoteric means a little weird. And the way I describe that is that the pharmacist, earlier I said pharmacy is a grind, and the pharmacist who's going to be in this profession for a long time will have to find joy in the small wins, whether it be catching up in all the blister pack checking for the day, or reaching a certain number of something, some metric that they're measuring. We need to find the small wins, because those will add up over time. And that's what allows us to be successful in our gritty way. The D stands for decisive discipline. We need to decide ahead of time that we're going to commit to winning habits and routines. So the 7 characteristics, all from the anagram layered, in my experience, not that I have the answer, but that's what I've found has worked for me as a pharmacy leader in the last 15 years.
Wow. A powerful framework, I must say. And one that resonates with me as a people leader at TELUS Health. Such a great way to show, Jason, that leadership isn't just about being in charge. It's about how you show up daily, how you react and respond to challenges as you face them, and how you help others grow. Greg, as we look ahead now from a technology perspective, how do you think pharmacy management solutions will evolve over the next few years? How is TELUS Health planning to adapt to the evolving landscape and innovate in the next few years?
Thanks, Lucy. If I had to pick one word to describe the future of pharmacy, I think I'd choose the word more. Pharmacy is going to be more complex with the growth of specialty and targeted therapies administered in the community, Pharmacy is going to be more integrated, more collaborative, and more interoperable with other healthcare professionals and technology platforms across shared practices, working towards better shared outcomes for patients, for example, collaborating to manage chronic diseases. There will be more tools and AI-enabled point solutions to support an increasingly complex and need to come together in a coherent pharmacy management solution. And finally, it'll be about doing more with less. Through reforms in pharmacare, an aging population, and economic and geopolitical uncertainty, the pharmacy industry and healthcare in general is going to have to be more innovative by necessity.
As we talk about the future of pharmacy, these therapeutic shifts give us a preview of what's coming. Our 2025 Drug Trends report shows that diabetes remains dominant, but other areas like GI condition and weight management are gaining ground. That tells us pharmacy teams will need to continue evolving clinically, technologically, and strategically to meet the demands of patients who are managing increasingly complex health journeys. Before we move to the Q&A, this final, most important question goes out to the entire panel. What do you think will define the next era of pharmacy? John, we'll start with you.
Yeah, thanks, Lucy. I believe pharmacist-led clinics will define the next era of pharmacy as the profession shifts towards a more clinical model to address gaps in primary care. Now, our Lawton's Drugs Pharmacy banner has 6 pharmacist-led walk-in clinics in Nova Scotia, for example. Now, this transformation is driven by several key factors, and I'll go over them. Pharmacists have specialized knowledge in pharmacotherapy, and this allows them to manage complex medication regimens effectively. This expertise is crucial in preventing medication errors and optimizing health outcomes for patients and impeding the rising cost of healthcare. Now, by addressing minor ailments and managing chronic conditions, pharmacist-led clinics can reduce healthcare costs. They help prevent hospital readmissions and decrease the need for more expensive medical interventions. With the rise in chronic diseases, pharmacist-led clinics can play a pivotal role in managing conditions such as diabetes, hypertension, and asthma. Pharmacists can also provide a range of preventative services, including immunizations, health screenings, and wellness programs. And these services are essential in early detection and prevention of diseases, contributing to a healthier population. Pharmacist-led clinics are poised to redefine the pharmacy profession by filling critical gaps in primary care. We'll now turn it over to Jason.
I think the rate-limiting step to change as we navigate will be our ability to coach it. We have to understand it, we have to be able to manipulate it, and for that, we're going to be able to need to coach staff, to coach customers, and to coach all of our vendors. We need to be together and we need to be collaborative and intertwined. While we see more tech and more tools, people need to remain the most important part of what we do. Pharmacy schools, specifically the 2 in Ontario, are already adopting leadership degrees to their programs. So pharmacists graduate as pharmacists, and they also have a leadership or people manager type degree with them. The school admission programs, yes, will try to find the best scientists, but at the end of the day, those scientists need to be able to communicate health to their patients. So we need to be people managers and well-rounded communicators as well as scientists.
Well, I think Jason and John have said it, Lucy. It's really about people. Healthcare is local, healthcare is contextual. We'll need to enable people, and technology is one of the biggest levers to do it.
Thank you again to our panel for such insightful reflections so far. We are moving into our audience Q&A portion. Our first question goes out to you, John. Given your role leading pharmacy innovation and scaling central fill operations at Sobeys, you've had a front row seat at how technology is reshaping workflow across hundreds of pharmacies. How do you see technology, especially AI, helping to ease the day-to-day challenges in pharmacy practice? And what's needed to ensure teams embrace these changes rather than resist them? To you.
Sure. That's a good question, Lucy, and one that a lot of pharmacists are also asking. So I've actually heard of some really interesting and amazing innovations in AI that are being applied to pharmacy workflow to help ease the staffing challenges in the industry. And these are not grandiose ideas. It's being piloted in community pharmacy right now, so it is near and it's coming. AI is being used to fill the staffing gaps in community pharmacy, like answering the phone, triaging and answering non-clinical questions. AI transcribing is also helping to document key points during a consultation with a patient, and it can summarize it neatly into a SOAP to communicate with other healthcare providers. And with the use of cameras, AI can also read prescriptions and assist with data entry. So for teams to embrace AI, I really believe that it comes down to trust and accuracy and safety, as well as robust regulatory framework that keeps up with this advancement in the field.
Thank you, John. It's fascinating to hear how AI is already being piloted in meaningful ways, from triaging calls to automating documentation. Jason, as both a frontline pharmacist and an owner deeply embedded in the day-to-day realities of practice, what changes do you believe are most urgently needed, whether it's in leadership, compensation, or infrastructure, to better support pharmacists in practicing to their very full potential?
I think all of those are critical. There's no one lever for the pharmacist to be able to solve all those problems. And the true answer for adaptation is all of those components in a combination of whatever the day brings. I think leadership is bringing people together and bringing out their best, and while coaching all of their opportunities. Compensation will be critical, not only for the staff, but also for the pharmacy. We need to be able to learn how to connect the new clinical services so that we can capitalize on the new billing opportunities as the old ones start to reform themselves. Infrastructure is going to be critical, of course. As we fine-tune all of our tools, all of our tech, our physical space will need to be ready for whatever that brings as well.
Appreciate that, Jason. Your point about needing a combination of strong leadership, meaningful compensation, and future-ready infrastructure really highlights the multidimensional nature of the challenge. Greg, given your role leading pharmacy solutions at TELUS Health, how do you see pharmacy management systems evolving in the coming years? And how is TELUS Health preparing to innovate and stay ahead of those changes?
At TELUS Health, we see pharmacy management systems evolving to become more seamlessly integrated with a broader ecosystem of specialized solutions. We anticipate and are investing in AI and its role as an increasingly important role, helping to automate routine processes, reduce administrative burden, and ultimately free up pharmacists to focus on more patient care. We're committed to continuously listening to pharmacists, to our customers, and to the evolving landscape of technology and regulation. With deep industry insight and focus on collaboration, we're confident that we'll be able to work together to adapt exciting new opportunities ahead.
Thank you, Greg. It's encouraging to hear about the proactive role TELUS Health is playing in making systems more interoperable and responsive to pharmacy teams' evolving needs. John, you've mentioned that you believe pharmacist-led clinics will define the next era of pharmacy. Building on that vision, how do you see collaboration evolving between pharmacists and other healthcare providers?
Yeah, that's a good question, Lucy. And I like how you use the word collaboration, because it really is collaboration and filling the gaps in the circle of care. So before we had pharmacist-led clinics, and I mentioned unattached patients, these patients would be going to urgent cares or emergencies and waiting hours upon hours for things like minor ailments. So if someone had a urinary tract infection, or they needed injection, or even a renewal of the prescription, believe it or not. So pharmacist-led clinics have kind of filled in the gaps in primary care where these unattached patients were waiting for a very long period of time and having access. It's all about access. So now we have these clinics and we increase the access, and what pharmacists do is in that whole circle of care, we then let their family doctor know, if they have one, or a primary care provider, that we've provided care to complete that circle of care so that patients are kind of in an enveloped system rather than, unattached, so to speak.
Thank you, John. As we close this session, thank you to our wonderful panelists for sharing their insights and experiences today. It's clear that pharmacy is at a turning point with exciting innovations on the horizon, but also real challenges that need to be addressed. Conversations like these are critical in shaping the future of pharmacy practice. Thank you to all for joining us today. Enjoy the rest of the TELUS Health Annual Conference. And now let's go back to Colleen. Thank you.
Thank you, Lucy, John, Jason, and Greg, for such an insightful conversation. To wrap up our session today, I want to take a few minutes to walk through the key takeaways. Key themes included the expanding responsibilities of pharmacists, operational challenges, technological innovations, and the future of pharmacy practice. When it comes to the evolution of pharmacy practice, we learned that pharmacists are taking on more clinical responsibilities, including administering vaccines, prescribing for minor ailments, and helping patients manage chronic diseases. Pharmacies have become a central hub for primary care, especially since the COVID-19 pandemic. The shift is improving access to healthcare and reducing wait times for patients. We also learned a lot about operational challenges, such as an increased workload and responsibilities require new tools and skills for pharmacists to ensure sustainability of the practice. There is a need to balance clinical duties with operational realities. A pharmacist shortage exists due to factors like insufficient graduates, high tuition costs, and burnout. Productivity challenges in the pharmacy industry need to be addressed. We also covered technological innovations, for example. Automation and digital tools are being leveraged to improve efficiency and allow pharmacists to focus on clinical services. Central Fill is helping to manage increased workload across pharmacy networks while reducing administrative overhead for pharmacies. Digital patient engagement tools like mobile apps for prescription management are becoming more common. Electronic health records are improving data sharing and care coordination. When it comes to balancing technology and patient care, some things to bear in mind were that implementing new technologies requires careful change management to avoid disrupting workflows, and ensuring patient safety remains a top priority. Success factors for digital tool adoption include staff collaboration, strategic partnerships, and ease of integration. There's a need to balance high-tech solutions with patient-centered care. The panelists also touched on the future of pharmacy education and leadership. Pharmacy education is evolving to prepare students for more clinical roles and entrepreneurial opportunities. Future pharmacists may need additional skills in areas like engineering, software programming, and business administration. Leadership qualities for future pharmacists include humility, autonomy, and decisiveness. We looked ahead at what the next era of pharmacy may bring. Pharmacist-led clinics may become more prevalent, addressing gaps in primary care. AI is expected to play a larger role in automating routine tasks and supporting clinical decision-making. Pharmacy management systems will likely become more integrated with specialized solutions and AI-driven tools. The industry will need to do more with less due to healthcare reforms and economic pressures. There are still, of course, challenges and opportunities that remain. For instance, regulatory frameworks need to keep pace with technological advancements. There's a need for sustainable business and compensation models for expanded pharmacy services. Opportunities exist for pharmacists to play a larger role in managing chronic diseases and providing preventative care. The panelists emphasized that while technology is crucial for improving efficiency in patient care, the human element remains central to pharmacy practice. The future of pharmacy will require a combination of clinical expertise, technological proficiency, and strong leadership skills. As the pharmacy landscape continues to evolve, there will be a growing need for collaboration between pharmacists, technology providers, educators, and regulators to ensure that the profession can meet the changing healthcare needs of the population while maintaining high standards of patient care.